Good afternoon.
Good
Good
afternoon, ma'am.
afternoon, ma'am.
Okay, I'll share with you. I don't know if you already opened the canvas. Okay, downtown atom assignment. Project we have assignment for class activity next week. So this is the continuation an AUIE before. So you made a patient history, system surveillance test and measures last time, and then in this assignment, in which you will also present the output next week. You will include the problem list based on EU patient condition, based on EU patient history, systems review, and test and measures beforehand. And aton last nga ito assignment. So, give mo ka man problem list, ICF, diagnosis and prognosis, expected outcomes, anticipated outcomes, patient and family education, and planned interventions. So we already demonstrate the different interventions last time. So at least may din nakam idea. I have an example here of problem list of a patient condition. Na may niya problem list, patient diagnosis, ICF. This is from my student before. ICF, then prognosis, plan of care that would include long-term goals, short-term goals, and patient family education. And last would be PT intervention. It's an example. And then after the presentation, we'll have a class demonstration, continuation in atom postural drainage, in which all of us will be practicing postural drainage, different locations, and exercises for lymphedema. So nag-start na kitang lymphedema, will continue and practice. And the last one will be self-manual lymph drainage. So I advise you to check this YouTube. Tapos may niyo idea na iton manual lymph drainage. And I think susuksok ko gihapon and compression pump therapy. Okay, later. Okay, then go back to module. So, additional readings. This will be inspiratory muscle training, position to relieve dyspnea, abdominal strengthening. This will be discussed today. And then, performative assessment. In Word document, there's a question. Will you recommend pulmo PT to COVID-19 patients? And what will be your pulmo PT recommendations and why? So, the pulmo physical therapy or the pulmo interventions, we already discussed some of the breathing exercises, okay, so mga techniques, airway clearance techniques. So, you have idea na. So, will you recommend? If yes, ay pagsingan no. Actually, you recommend pulmo PT to COVID-19 patients. So, yes, and what are your recommendations? So, when I asked for recommendations, ano ni mo mga pulmo PT or pulmo interventions? So, may na kam idea and why. So, in answering the why part is, how does it help mga COVID-19 patients and imo intervention? Okay. So that's it. And in this module, I will include later and chest pulmophysiotherapy. I-upload ko na lang niya. This based on Kistner. So anatong postural drainage will not be We will not be doing pulmophysio or pulmopity or the postural drainage based on Hiliegas. Kumbaga we will practice based on Kisner. Kay usually Kisner din papakya na board exam. So ada kita kan Kisner. Kasi may dapat kakaiba ni Hiliegas kan Kisner. So Kisner kita ma-focus. So this I'm not going to discuss this. I will just include this. I will just upload this. So the outline of this presentations, breathing exercises, which you know already, coughing exercises, postural drainage exercise, and manual therapy. So when you say manual therapy, it includes percussion, vibration, and shaking. So those are manual therapy for pulmonary. Okay, so I will just upload it later. Ano ha, may natawag dali. Okay, sorry. Please. So I'm going to discuss peripheral vascular disease. So this would include just a recap on mga peripheral vascular diseases and the management. So at least may na kamo idea, nag-demo anay kita before hindi nga discussion. So mas malaksi na hiya maintindihan. And by the way, as you notice an aton demonstration, so more on pulmo and peripheral vascular disease. Ano man latan aton? May na ka may idea kung ano latan aton for cardiac conditions? An idea kung ano aton interventions for cardiac conditions? May daiyo na maaram? Ang cardiac conditions. Ano mo lang cardiac condition? Kung malak istorya dihin pulmo, aton tawag ini aton ayaw natin pulmo. Okay, pulmo ngan peripheral vascular disease. How about on cardiac rehab naton or cardiac conditions? Anon aton interventions or intervention? Para idea? Ano ba ang bakun? Napati ka mo hapon. Napati ka mo hapon. Pero wala ka may idea. Okay, so, anay ha? iti yung cardiac rehab. Amo na ito nakinsendhan last time, which is the cardiac condition. For cardiac conditions, we have this cardiac rehabilitation. Gamit the phase 1, phase 2, and phase 3. So that is for our cardiac patient. So more, kumbaga, ang cardiac rehab, it's a aerobic exercises and, or we call it conditioning exercises. Okay? So, amo na aton cardiac rehabilitation. And you can incorporate kasi some of the cardiac patients, may danera mga peripheral vascular diseases or may danera pulmo problem. So, i-incorporate mo liwat ang mga pulmo physical therapy nato ng peripheral vascular disease. Okay? So, amad to an aton cardiac condition. So, by nasing, para cardiac conditions. So, if you go back ang presentation nga recorded last time, mabalik ka mo, that would be the cardiac rehabilitation. So which is also ang part ng EU formative assessment and yung assignment yan ang ginpasa. Okay, so may na kamo idea to, ha? Kaya mas ni kamura yung magpurmalat to pulmo nganhin anong gin-demonstrate. So, dili may tukurog sigmon nga if it is cardiac problem na mas better, but if there is other underlying diseases like may pa niya PVD, may pa niya pulmo problem as a complication, you can add mo pulmo physical therapy or intervention nga atong gin-demonstrate. Okay? So I hope that's clear. So ako ni presentation niya na is peripheral vascular disease. Kasi naghatag na ako hin discussion for pulmo rehab nganhin tawagin ni nganhin cardiac rehab. So peripheral vascular disease. So management for arterial disorders, venous disorders, lymphatic disorders, and other interventions for cardiopulmonary conditions. Maron naman kamo kay peripheral vascular disease nauupod diya pag cardiopulmonary conditions. Okay. So arterial disorders, just a recap lang, we have the acute arterial occlusion, we have the arteriosclerosis obliterans, and we have thromboangiitis obliterans and Raynaud's disease. So an imo acute type of arterial occlusion, may niya clinical signs and symptoms and 6 Ps. The polar pain with intermittent claudication, paralysis, pulselessness, and paresthesia. What is polar? Any idea kung ano polar?
Namumusag, ma'am.
Namumusag? How about pallor? Baliktad, pallor ang mamumusag. Kung ang polar is
kanan cold, ma'am.
Mahagkot ang iya extremity. Okay, polar bagahin polar express. Polar. Okay, ulcerations. If the acute arterial occlusion by ulceration is the most severe and disabling complication. Kasi maulol na nga daan, may dapan yung ulcer. And of course, pag arterial problem, may trophic skin changes. And ASO naman, or arteriosclerosis obliterans, this is a narrowing and fibrosis of occlusion and occlusion of the large medium arteries. So in compared to acute, medyo mas chronic in hiya. Or it could start from acute arterial occlusion nga ma-lead to arteriosclerosis obliterans. But this is pertaining to a large and medium artery. So, ang iya hini tawagin ni, kumbaga large and medium arteries, ang iya hinin coverage han iya problem, mas medyo dord ako. And this is the most common of all arterial disorders affecting lower extremity. And if it is related naman to cigarette smoking or nicotine use, yun, it calls thromboangiitis obliterans or TAO, also known as Buerger's disease, in which there is ischemic ulcerative necrosis. But it can also start as an acute, nga may 6 Ps, acute arterial occlusion. Kaya di may ito diretsyo masusugat iyat tiil, mag-ischemic dayo, magiging magkakadahin ulcer. Okay? So kung continue lagapia actually the common symptoms ni Rainier are the 6 Ps, okay? And 6 Ps. And pallor, polar, pulselessness, and so on and so forth. Kumbaga, uncommon ni Rahinin, mas aging baga nagnanam, bagahin, amo na ito na nahagkot, tapos nakamot. So, nagtitika nga nin hiran so gadini. And so, kung continue pa hiya, pag sinagrilyohon aton, magtitikang nalotot iya, pagkamatay na iya tissue. Okay? And for Raynaud's disease naman, this is the vasospasm. Okay? Kung vasospasm, ma-constrict, ma-dilate ang iya vessels. Specifically, arterioles or small arteries of the fingers. So may nakita sinising a French flag sign in which may white, may blue, and redness ang iya skin. Okay, and it is called Raynaud's disease if it is with known etiology. But if it is unknown, it is called Raynaud's phenomena. Okay, what are the management of arterial diseases? Absolutely contraindicated an immunotherapeutic exercise. Okay, kasi in these cases, medical or surgical emergency, especially if it is an acute arterial occlusion. So, di mo ito malalabtan. Exercise ka pa ngayon ng nahahagpot na nga ni kulang na nga yung circulation, mag-exercise ka pa. Okay? So, the mainstay treatment position is to assume dependent position. We all know this, that if it is arterial problem, nakadependent, di siya pwedeng elevate an extremity. Kasi dama duroy. So, nakadependent position at hiya always. Okay? So, during acute care, so emergency maninhira, acute care, anticoagulant therapy. And reflex heating, di ba? Reflex heating, maram na kamo. And you can, if it is tolerated, kung tolerated ni mo patient, you can start mild resistance range of motion. Active. Mild or active range of motion anay, then may dala niya circulation before ka mag-start hatag in resistance. And of course, skin and foot care. Okay. If it needed ang patient, pwede mag-surgical management. There's a surgical management like atherectomy in which an arteriosclerotic nga or plaque kukuhaon or thromboembolectomy anya thrombosis kukuhaon or laser therapy. The same concept, pangunguhaon ang mga plaque. Or revascularization, angioplasty, or bypass grafting. So we all know this one, ha? Kaya baga naman siya nagapinihan aton demonstration. And sympathectomy in which yung kakat ang sympathetic nerve and para lang mag-continue lang ang vasodilated and vessel. So it improves the blood flow. And amputation kung may gangrene. Kasi kung di amputate, nagtitika dako iton problem or gangrenous part. Okay. Simpahan mga kalagsang kikinaon. Okay. What are the special exercises for our arterial diseases? We have the Berger-Allen exercises. So this includes leg elevation with ankle palms, sitting dangling with ankle palms, and the last one will be wrapping the limb to increase temperature. Modified Berger-Allen exercise is a Berger-Allen exercise plus postural exercises. Okay? And active exercises, we all know kasi pag there's active exercises, there's pumping of muscle pump na improve ang atong blood flow. Okay. Although this modified Berger-Allen exercise, it affects less pronounced in patient with PVD kasi at least nakakahatag kita panalagsa nga o baga circulation naman nila. Pero diri good hiya natural ka may problem naman hiya arteries. Okay? So at least nakahatag nato ganmanhin at improvement niya circulation. You can also try resistive cough resistance exercise, which is most effective method of increasing blood flow. So most common kasi an aton arterial occlusion at the hollow extremity. So gastrocnemius and soleus pumping or the muscle contraction of those muscles, pwede hiya makabulig pag-pump ang blood and also mag-increase in circulation. Of course, grade ambulation, mara naman kita, no? This is to the point of pain only. We know also Viking test claudication. Okay? Exercise training effects improve functional capacity, improve peripheral blood flow and muscle oxidative capacity. This may be part of your intervention rationale. So if you're going to include grade ambulation, for example, if you're going to include intervention as grade ambulation, ang rationale to improve functional capacity, to improve peripheral blood flow, or muscle oxidative capacity. Ayun. So usually, and prescription, exercise training prescription for arterial is the use of interval training. Ano to interval training natin? May idea han interval training. This is with rest. Okay. As we all know, arterial occlusion or arterial problem, kung di ba kung there's some movement, eventually nagkakaadahiyahin claudication or leg pain or graded ambulation. So dapat kaiya interval training in which after kanya walking or if it is walking, after niya walking, bidan niya gaman rest in between para diri mag-inulul or to the point of pain lang. Okay, walking program, if you notice, moderate intensity and duration 2 to 3 times per day and 3 to 7 days per week. So as much as possible every day, but 2 to 3 times a day liwat hiya. Diri lot hiya focusing, diri hiya person aton cardiac problem nga o cardiac rehabilitation nga na pwede ma-increase in conditioning exercise in which ma-increase ka. Increasing gap hiya, it could be increasing bali, pwede ka mag-increase ang time, but ano mo frequency, hindi magtitika decrease, okay? Increasing ang time. Dito kaya pwede increasing ang frequency, increasing ang time kasi may niya lag pain na feel. So at least ikakat nimo ang iya walking program into different time in a day para may niya rest period. Okay? And we use subjective ratings scale for pain. So those are your that would be your board rating scale. Okay? You can also advise or prescribe non-weight bearing exercise if it is necessary for a patient who cannot walk. Okay, so but this is less effective in producing peripheral conditioning effect. Kasi you can, especially if it is an upper extremity ergometry or arm ergometry. So mas less an aton movement than aton blood if we use small muscles. Unlike an aton large muscles sa lower extremity at gamito, mas naka-improve gadman. Kasi there's a large muscle movement or contraction, nagpapumpin maupay an aton, and nakaka-increase an imo blood flow. And you can also advise a well-fitted shoes for insensitive feet and teach techniques of proper foot inspection and care. Dili lang mo patient but as well as the family members. Okay, precautions naton sa koroksingon. Bisan hiya may sugad hini, a problem, pwede mo hiya tawag ini as tolerated. So when you say exercise pain, it is a leg pain after exercise. Narupupudo siya after exercise. We call it exercise pain. But if your patient have resting pain, di rin mo pwede i-exercise. Kasi stress pala, maulol na. Okay, you can do reflex heating or other, or if it is not the lower extremity, if the lower extremity is the affected one, you can do an exercise sa upper extremity instead of the lower extremity para mag-increase agad man dito ang circulation. A little lang. Pero di mo pwede palakton. Or if exercise itong rest, kung may patient may resting pain. Paresthesia, you can exercise patient with paresthesia as long as it is tolerated. Okay? But cryotherapy is contraindicated. Hagtot na iti mo patient, butangan mo lang direct cryotherapy, bisan pati indirect, diri pwede. Kasi damo hiya diri ma-increase ang iya circulation. And diri niya tolerated iton, less na it iya, kumbaga very sensitivity skin, less na tiya tolerance. Okay. And if there's also risk factor modification, if your patient may na smoke or obese or taas iton sugar. Okay. Limb protection. So avoid excessive strain, protect the extremities from injury or extremes of temperature. So diri pwede direct heating and direct icing. May extreme temperature. If bed rest may be required if there is gangrene, ulceration, or if it is acute arterial disease. In acute stage pala, bed rest. And of course, medical management. Okay, next we go to venous disorders. So we have acute and chronic type of disorders. The acute, imagine ha, it acute, ini nga picture. Sorry. So mapula. Mapulaan tiil. Acute inflammatory condition with occlusion. So when it's acute, it is inflamed, ay namumula, and it could affect the superficial and deep vein by a thrombus. So kung superficial venous thrombosis, it resolves without long-term complication. But if it is a deep vein thrombosis, medyo dakulayat mo problem. It could also dislodge, madi-dislodge kung di rin magkadahin medical management, madi-dislodge siya magiging pulmonary embolism or worst pa. Pulmonary embolism is worse na nga nito ya, okay? So, pwede stroke, pwede cardiac arrest, okay. So, DVT, ngunit atong kikita ha mga immobile na patients, ha? And also the post-operative patients. But it's also common na obese patient, mga kalagsan, orthopedic injuries, CHF, malignancy, or the use of oral contraceptive, and pregnancy. Pregnancy and obesity parasitera concept. Okay, any post-operative patients, kasi may kita cardiac conditions nga na undergo surgery, di ba? Or pulmonary condition na undergo surgery. So, kikita mo dahil tiil, sano ka nito palakta ni mo patient. Maram na ka mo ito, you have to check kung may ito nila pamula-pula, may inflammation, masakit, may haranat ang patient. So, ayaw ito labti, i-refer ito ha, iya doctor for further medical and management. So, chronic venous disorder, we have varicose vein and chronic venous insufficiency. If you notice, diri mapula. Maitom-itom niya. Brownish discoloration, we call it hemosiderin. Okay, brownish niya discoloration. Diri pula in compare with the acute type of venous disorder. Okay, signs and symptoms of both the acute and chronic venous insufficiency. Chronic disorders, venous disorders. We have, again, acute, there is swelling, there is pain, there's tenderness, inflammation, and discoloration. Discoloration for acute is mapula. Okay? And chronic naman is there's a dependent edema. When say dependent edema, kung na-elevate niya lower extremity, wala edema. Pero kung na ada ubos or any dependent position, nahigleling ko diri gini-elevate, nagkakaada yung edema or naduro yan yung edema. And the pain is aching and tiredness of legs. Okay? And pain hanimo DVT or acute thrombophlebitis is masakit talaga hiya. It is actually rest pain. Rest pain pala, masakit na during rest. Inihiya, usually an aching and tiredness of the legs after hand walking or tunggudan edema. And there's increased pigmentation and stages of the limb in which an iya pigmentation is brownish color. So again, discoloration may dihara nga duha, hi acute makula, hi chronic ma-brown. Nga brown hiya nga may itom nga ma-brown or brownish. Okay, and skin ulcerations. An acute nimo waray ka pa ulcers, okay? Waray ka pa ulcer, pero dili ka na chronic may ulcerations. Okay, ano yung nasa ko. Okay, so management for venous disease, DVT. So, animo DVT kasi, it might be asymptomatic for some patients, but if there's symptoms, dull ache, pain, tenderness, and cough, and slight edema or fever. So, ito pala nga mga signs, o ito nga symptoms, tapos nakikita mo nga signs nga mapula-pula, inflame, nahubag, inflame. So, red flag na nimo ito nga di mo hiya lalabtan. Okay? Acute, bed rest. And you could advise elevation of the involved leg, but gradual lang. Ay pagkataasan duro ka, bangit to madislodge. Okay, and bed rest until signs of inflammation have subsided. So when are you going to start your physical therapy? Mawara na ang inflammation. Okay? So kung nawara na inflammation because tatagal niya medication, mawara, pwede ka na mag-start. Hindi mo na makita ang inflammation. We call it anticoagulation medication. So, tatagay ito mo patient, then after the niya medication, saka ka na mag-exercise. So, exercise therapy is contraindicated during acute phase. So, bagay nihiyakan, tawag ini kan acute arterial occlusion. So, di ra pwedeng exercise dayon, ha? So, increased pain, mas na-increase ang pain, acute phase, and potential to dislodge clot and progress to pulmonary embolism. Okay. If ambulation is permitted, so kung sabi nga okay na for ambulation, mapakya na ka doctor or advise ito or ma-prescribe ito or may written advice ito from the doctor na pwede ka na mag-ambulate. And also, to make sure, you check for local tenderness or swelling. So, pwede mo hiya mag-ambulate ka na the use of elastic stocking. Okay? In a chronic venous problem, an atom good management is for edema. Okay, positioning. So, elevation of the lower extremity, na minimum of 18 centimeters above heart. But as long as it is above heart, di ka na malimot ka na ngayon 18 centimeters, basta above heart, okay na ito. Encourage patient to elevate leg as much as possible. So, korog sigon, di mo ito korog sigon nga maglilinaw pa natin patient. Malakat yung patient, pero after niya paglakad, elevate niya niya lower extremity and avoid the dependent position for prolonged period of time. Okay? And compression therapy, ayun, maroon na kitang bandaging and paste bandage, which is the una boot. Graduate compression stocking, which is the jobs. And compression pump therapy. Amo yun atong walilog ka-discuss ang compression pump therapy, which is i-include ko gapi needed to hit atong demonstration next meeting. Okay, so huwag mo ang compression pump therapy, direct marang kung okay pa, kung nadara pa, mapakyan ako. Okay, red flag, dili ka pwede mag-compression therapy kung ang ABI is less than 0.8. Okay? Or with active cellulitis or infection. So this is some of the compression garments. Okay, and graduated compression, we know the concept if there's edema, we know the concept if there's edema that the pressure is increased or pressure is great didaha distal part before until pag pikadtulat ha proximal part mas nagli-lessen iya pressure. Okay, para na-assist iyahan blood flow or venous return. Okay, this is a compression pump therapy. Matatan buhugmon ha clinic. Sana dumara para maka-feel ka mo kung nag-aano hiya. Pumping lahiya bagan muscle nga bagay pagiging pressure, may pressure here. Actually, may pressure tapos there's a pumping, there's resting period, there's a working phase, there's a resting phase. Anyway, in continuation, han EU management for edema exercise. We can provide active ankle exercises, cycle ergometry, in sitting if di rin nakaka-tukdaw, early ambulation as soon as patients able to get out of bed. Okay. Patient education, skincare. So they're learning acute, actually all peripheral vascular disease should include skincare and foot care. With lymphedema, it needs foot care and skincare. Okay. Severe conditions with dermal ulceration will require ligation, vein stripping, vein grafting, or valvuloplasty. We discussed already this one already. And of course, faradism under pressure, ma'am nakamo. So faradism, which is electrical stimulation, pressure is compression plus elevation. Ayun. Retrograde massage. And for lymphatic disorders, liwat. Okay. Compression therapy, retrograde massage, elevation. If you notice, pare-pares siya kan venous disorder. Iti management ni lymphedema is pare-parehas kan venous disorder because they both have edema. Okay? May nila di edema. Compression therapy, dagapito kan venous. Retrograde massage, the same thing. Elevation, parehas la. Okay? Mira naton for lymphedema, we call it decongestive therapy and which include that's the management for lymphatic disease, which include phase 1 and phase 2. And phase 1 is edema control because there's edema secondary to dysfunction. So, yung patient may dysfunction, may disability because of edema. So, it included natin ha phase 1, amo natin na mention ang una natin. Hande mo nga short stretch compression bandage. Okay? So, hindi nga nakabutang 24 hours. At least 23 hours siya. Tagamulan 1 hour para kumarigo. Okay? So, we know the short stretch compression bandage. Tapos, include na gabi an MLD on manual lymph drainage. Okay, this is massage and passive range of motion to assist lymphatic flow. Bila kita Vauder techniques or modification by ASDOC, ALEDOC, and FODAI. Emphasis on decongesting proximal segment first, which is the end extremities. Okay. Now, bayan ka malipat ha, the concept of MLD or manual lymph drainage, whether it is a massage or the exercise for lymphedema, which is basta drainage. It could be exercise or massage. Kung massage, manual lymph drainage. And naton exercise and ginhimo naton, which is part na naton demonstrate last time. It concept ito maaram na kamo. We have to drain the proximal area first before the distal area. Okay. And concept and massage liwat, the same. The same gihapon. Pero kung maggamit ka ng massage, na-drain mo ng proximal area, okay. So, ma-start ka ng proximal area in may edema, proximal area in upper extremity. Iting pag-massage liwat is from distal to proximal. Okay? Distal to proximal. So, kaya ka mamalipat ha, an aton manual lymph drainage as well as exercise for lymphedema, it concept parehas lagi hapon. You have to drain the proximal part first before the distal. But in manual lymph drainage, an imo pag-massage is from distal to proximal. Okay? And then phase 1 included na gyap niran skincare. Okay? And exercises, amo na aton exercises for lymphedema. Okay? Work trunk, limb girdle muscle first, which is the proximal area, from proximal to distal. Okay, so an imo active muscle contraction is from proximal to distal. You can perform with the exercise with a compression bandage as well, and also pwede gapiya together with MLD. Okay. You can incorporate walking program or cycling depending on yung gusto ni mo patient. And water-based program, very effective as well because in imo water may the naton pressure ha water, which could assist the venous return. Tai Chi and balance activities and ADL training. Okay, and red flag for exercise, strenuous activities, jogging, and ballistic movements are contraindicated for lymphedema patient, ha? Kasi, there is a pumping of muscle or there's a muscle contraction, but after that, an imo strenuous activities, dumuroy lugod an imo lymphedema. And the signs of lymph overload should be checked, ha? Signs of lymph overload, nakita ka man ito, signs of lymph overload, which is discomfort, aching, pain, proximal lymph areas, and changes in skin color. Okay, and lymph areas nimo are the axilla and inguinal areas, for example. So if there's a lymph overload, discontinue activity. Okay, and elevate the lymph and apply cold packs. So pwede ka mag-apply ng cold packs to further or to stop the increase of edema. Okay. Phase 1, continuation, we can use compression garments. And red flag lang of using compression garments, excessive high pressure will occlude superficial lymph capillaries and restrict fluid absorption. Yun lang. So there are many sizes for compression garments if it is ready-made na dapat sakto hiti mo patient. How do you know? Waray masakit mo patient, diri maulol, diri gyap nangingito mitiya distal extremities. Okay, nga nakaka-move itiya extremities gadman with the compression garments. Okay? Now, the phase 2 is self-management. So if the phase 2 is actually a continuation of phase 1. But ang difference nira is that in phase 1, aada ka nga PT ma-assist, ma-instruct, mag-guide, and also ma-teach ang imo patient para in preparation for phase 2. Parang phase 2, ang patient na ang maglulugaring. Okay? And another difference is that an bandaging or compression garment or bandaging must be used at night only, gabila, and MLD as needed. And massage, manual lymphatic drainage is dirihiya kinanlan na permanente as needed na lahiya. Okay, but continuation and skincare, compression garment, exercise, compression pump, compression pump therapy nga wala tayo demonstrate. Okay? And amala ito nila, and exercises. Yun. So this is an example of drainage exercise. Okay. And red flag for self-management, pressure higher than 40 millimeter mercury are contraindicated as they can cause lymphatic collapse and contraindicated with soft tissue injury. So, this is for those compression garments. Okay? So, and dapat hiya, as I've said kanina, dapat diri hiya tight hinduro. Bisan nga di ka maarang compare to apparatus pressure to as long as diri tight and imo patient, comfortable hiya, pero may naman pressure nga nahihinabo. Pero comfortable hiya, nakakalakat hiya, nakaka-move with extremity, waray pag-ulul. Okay, that is good na. Education for both phase 1 and phase 2. It will be skin and nail care, self-massage, self-bandaging, garment care, infection management, and maintain exercise while preventing lymph overload. So nga tanan nga peripheral vascular disease may the skin and foot care. Okay, let's go to self-manual lymph drainage and MLD, what I can discuss, which will be we will all demonstrate the MLD and also practice. Is one component of a complete decongestive therapy. And aton decongestive therapy, amo nato may the phase 1 and phase 2. Okay, that is your decongestive therapy. And decongestive therapy includes MLD, compression, exercise, skincare, and education. Okay. An MLD is a manual technique using light pressure and rhythmic pumping to increase lymph flow in appropriate direction. Diri hindi ma-massage nga deep pressure ha, diri na siya. It's a light directional pressure, work from proximal to distal. Naman kamo kalipat ha. This is a massage from proximal area to the distal. But if you apply the massage, it is from distal to proximal. And there is a stretching. May kita stretching apart ini. Okay? The route of the lymph drainage is a one-way lang. Di ba one-way lang atong flow? Di mo ito timo arteries na balik, na backflow, di ba? So, an imo venous gihapon, venous blood, one-way lang kapit, pati kapit imo lymph. One-way lateral flow. So, an imo flow is towards the heart. So, amo yung imo pag-massage. So, if it towards the heart, it is from proximal, from distal to proximal. Okay, effects of MLD is to decrease pain, swelling. So again, pag pain ngayon lymph edema is bagang parehas kan venous disorder in which there is heaviness nga pamati ha patient symptoms. So and swelling may nakita, increase in lymphangiomatoticity and increase in venous return, And any more lymphangiomatonicity is that the movement of the lymph na increase. And of course, dila animo lymphatic flow, but also the venous return. Okay, and there's soothing and analgesic effect because it is a massage. Okay, kung may ka mo myotomes, dermatomes, may kita lymphotomes liwat for for lymphedema, for vessels, okay, for the lymphatic system. Okay, so the major lymph node location, madali lang maintindihan. You can start from the neck. O yan, neck. Tapos, elbow. Neck, axilla, elbow. And then, inguinal nodes. Okay. May hita and the popliteal nodes o back of knee. Madali lang yan maintindihan. Okay, those are your lymphotomes. And an imo self-manual lymph drainage. Okay. Gi-emphasize ko kasi din self-manual lymph drainage. Actually, use of physical therapists can do manual lymph drainage ang imo patient. Pero, simpanato naton decongestive therapy, may kita phase 1 nga nagtutudok kita, may kita phase 2 nga ang imo patient na magmamasahe. Okay, so importante the patient learns to learn self-manual lymph drainage. Okay? Dire ka ikaw la permanente sa PT. So there are 2 phases for each stroke, working phase and resting phase. So an imo working phase is a stretch applied to tissue. Now, you can try this now. And you can use the palmar surface of your hand. It could be the palm or the finger. So kung dako nga area, pwede inihiya gamiton. Pero kung gutila kaya, pwede ang dili nga side. Okay, so kung ini nga arm ito itong gagamiton, okay na malat inihiya nga part na natong finger, palmar side na natong finger. Stretch. Okay, stretch. Ani mo pag-stretch, okay, didakat imo kamot hit imo skin. So it movement is it imo kamot diri na slide. Okay? It movement diri kamot na slide, it imo skin hit imo kamot nagdudungan. Okay, stretch ito hiya in one direction. Stretch mo ya upward in one direction. Okay? So if you notice, may stretch mo na nga ng skin, okay na ito hiya. Ayaw na pagduruha. And pressure, imagine, and pressure is just on the skin. Ayaw i-move and pressure downwards to the muscle. So dili pwede ang muscle upod, ha? Skin la. Ang skin la an may da, iti mo itatry pag manipulate or pag massage. Okay, so if stretch mo hiya, kung ma-stretch na skin, sakto na ito ya. Kung kutob la din ang ma-stretch ang skin, amo la ito. Ay pag dinuruha. Kasi pag if iduruhan mo hiya, ma-slide na hiya, which is very as siya. Amo ito yung ka-light and iya pressure. Just enough nga imo skin ma-move. Amo ito iya ka-light, ito iya pressure. Okay? Now, resting phase is when you stretch it, that's the stretch working phase, that is a working phase, and you stretch mo, and imo resting phase, i-release mo ng pressure. So, move mo, and then release, that is resting phase. Okay, the skin passively moves back to starting position. Okay, again, stretch mo hiya, then release. Stretch, then release. Okay. Amulate yung ka very light it imo pressure as long as ma-move mo lang skin. So there's a stationary circles. Stationary circle again, as long as ma-move mo lang skin in a direction of a circular direction, sakto na ito ya. Ay na ito pag dinuruha nga i-move mo pa inward nga pati ang muscle. Diri ka na ng muscle, ang skin la, ang skin. Okay. The stationary circle is you can use the palmar surface of fingers or hand depende han location. Kung dako nga part ani mo hand palmar side of the hand hiniya. Okay, so ani mo stationary circle, there is a working phase and there is a resting phase, but in circular motion. Hand does not slide. Tigamit to diri na slide kasi diri to dapat may pressure, may friction nga may hinabo. But diret nin pwede butanganin oil. Kasi butanganin oil or lotion or powder nga may slide it imo kamot, waray na effect. Kasi dapat na move together ang imo kamot pati ang iya skin and patient. So I hope that's clear. So this is the Bowder strokes. So we have the stationary circles, the thumb circles, so thumb lahiya, and we have the pumping, ang pump. So later on ang pump. So the pump technique is the hand is placed at the right angle of the skin, and fingers stretch skin in one side and thumb on the other side. So nagbubulag inhera nga duha. Okay? So anyway, magpa-practice man kita niya tawag ini next week. So and skin moves in proximal direction. So from distal to proximal. So there's pumping technique. Okay. Anyway. Okay. MLD includes abdominal breathing, just like the exercise for lymphedema. May breathing kita which includes, may breathing exercise kita parahan aton proximal area. So it will start in abdominal breathing. Okay? Abdominal breathing and massage liwat gihapon ha proximal area or sa trunk ni mga side. You can start with the neck region where there are lymph nodes. Okay? So we start with abdominal breathing. Supine is the best position. And para makasabot kita nga ang patient na gamit ang diaphragm, ibubutang ang kamot ha, abdominal. Ayun. So let's go to other PT intervention for cardiopulmonary conditions. So airway clearance technique. So when you say airway clearance, it clear an airway. So whatever nga dapat igagawas. So natong common ginagawas is dire pagkaon but luka, okay, or phlegm. So an aton technique includes coughing, huffing, assisted cough, tracheal stimulation, and the tracheal suctioning. So anyway, maam naman kamong coughing and huffing, di ba? Ang ngatan niya actually maam na kamo. Yung papasabot talaga mo nga amot hirat airway clearance technique. Okay, and coughing, magagamitan naton kung ada na ang luka harani na haimo, harani niya dinhi. Okay? Kay kung sige tim gamit mo coughing, harayo pahiya, kakapuyon lang nimo patient. Gamito mo na ang huffing kung harayo pa ang plema. Adi pala haya didit na tungo dit imo lungs. So huffing technique ito. And coughing, ano mo pag-expel na, din harani na, i-expel na ito. So we start with, kung diri kaya ini nga duha ni mo patient, assisted coughing, right? And if diri kaya assisted coughing, tracheal stimulation. Kung diri kaya tracheal stimulation, ayun, suction mo na ni mo patient. So we know assisted coughing. Okay, so we have different position for assisted coughing. Of course, kumbaga, since nga weak ang abdominal muscle, na-assist kita. Na-provide kita pressure or force nga tuhan from the abdominal part. Baga kita hiton bubuligan ta ang diaphragm or abdominal muscle, that is with abdominal, not the diaphragm, abdominal muscle para mag-generating force. Okay, so nabulig kita kan abdominal muscle. But the amount of force that we provide will depend upon patient tolerance. So, pag ura-uraha, okay, and abdominal sensation. So these are different positions that we can provide assisted coughing. Okay. Tracheal stimulation, if patients unable to cough on command. For instance, infants, ikaw masing ubo, baby, ubo. Hindi mo tayo maarang kung tubo. So you can do tracheal stimulation. Or patients with TBI or stroke. Or, pwede nagyapira. Kasi ay pwede gihapon kung may the weakness ng iya diaphragm and also abdominal muscles. Okay. The therapist's finger, maaari naman kita, or thumb, is placed just above the suprasternal notch. Ayun, may quick inward downward pressure. Okay. An emo suction or endotracheal suction is the other airway clearance techniques. Kumbaga, it is an airway clearance technique kung ang iba, di rin na niya kaya. So this is the last resort na nimo. Okay, but there's a standard precautions because you're in contact with patient's body fluid. Okay, ay latin haranin duro. Okay, we all know the endotracheal suction kasi may naman kita nakita nga videos from your classmates. So at least may nakita ito idea. And let's go to inspiratory muscle training. So when say inspiratory muscle training, the inspiratory muscle is of course the diaphragm and intercostal muscle. For the intercostal muscle. So we have to strengthen the diaphragm and intercostal muscle. Kaya ano natong kailangan inspiratory muscle training? Kay it's either weaken niya diaphragm or weaken niya diaphragm, di yan nagamit niya diaphragm during inhalation. Okay, so makikita nato, may nakita nato ng patient ng mga chest breather, upper chest breather. So kung makita kita nga sa ultimo patient, hindi yan nagamit diaphragm. You can train your patient using inspiratory muscle trainers. Okay, we have different IMT devices, different modes of training, which is the flow resistive breathing and threshold breathing. So ano mo, flow resistive breathing, ining IMT, yung inspiratory muscle training is during inhalation because of the diaphragm. Diaphragm ito mo strengthen. So malatiya gamit inspiration. So during inspiration, so the patient inspire through a mouthpiece. So ining mouthpiece, nagtitika kuan na natong panahon niya, nagtitika iba't tsura. So dependehan mga tawag ito, dependehan brand, nag-iiba-iba itsura, pero parehas lang kapira concept. Okay? There's a resistance during inspiration. So, para magkadahiyahin strength mo diaphragm. Ining a flow resistive breathing is that there's a decreasing diameter. Okay, na-start kahin dako nga diameter. So, mo dako nga diameter, compare ang guti nga diameter, mas increase ang pressure na hatag kung guti nga diameter. So, mas start ka dako nga diameter and then nagtitik ka guti. Okay? And threshold breathing is that it requires a buildup of negative pressure before flow occurs. So, unlike your flow resistive breathing, ining a threshold is that imo hiya nagbi-build up niya negative pressure ito nga valve before may influx of air. Okay, pero yung influx of air or inspired nga air may niya pressure. But the pressure is consistent. Unlike yan imo flow resistive breathing is that it might be decreasing. So na-increase decreasing ang imo diameter. Meaning increasing ang imo, nititik ka increase ang imo. So, depende nimo diameter ang ginahatagan imo patient. Kung dako, mas okay laan iya pressure. Pero kung guruguti ang diameter, mas increase ang pressure. Iniya consistent. Okay. So, indication halimo IMT, it is indicated for impaired inspiratory muscle strength, and to those who have ventilator limitation to exercise performance. So, dapat niya indication, amot yung bubuhaton, i-prescribe ha imo patient. Precautions and contraindications lang, you may look for signs of inspiratory muscle fatigue. Okay, di ba ang imo breathing exercises, usually 5 repetitions. Okay, di rin na pwede mo ito i-increasean pa yung mga 20 repetitions kasi kakapuyo ng imo diaphragm. Remember, your diaphragm contract involuntarily. So, bahay niya kapuyo, hindi na't guminhawang ang patient. Okay? So, kailangan diya kapuyo. Pwede mo buhaton as like your demonstration before, last week, pwede mo buhaton yung mga IMT. Pwede hiyahan 2 times a day, but 2 sessions per day, for instance, but you can have at least naman a rest period in between. Okay, so what are the signs of inspiratory muscle fatigue? Yung takip niya, reduced tidal volume. So if there's a reduced tidal volume, decrease in oxygen and exchange of gases, so midani mo increase of carbon dioxide, hay imulawas. And badip niya and decrease minute ventilation. So what are the expected outcomes? It increase inspector muscle strength. How do you know nga may na muscle strength, increase na niya muscle strength or endurance? Waray na niya dyspnea. Di rin niya nag-SOB, nagamit na tiya diaphragm, waray na niya sinisiring may endurance na iya, waray na niya diya kapuyon, bisan na ADL, bisan nag-jogging na hiya, nag-walking, nag-jogging, di niya kinakapoy. So okay na ang imo muscle strength and endurance. Okay? And decrease dyspnea, yon, and increase functional exercise capacity. Another way of strengthening abdominal muscle is to use, if the abdominal muscles are too weak to provide effective cough, you can do abdominal sprinting. Okay? This is for high thoracic and cervical spinal cord. Baga assisted coughing lagi hapon. Okay? And you can also use or advise glossopharyngeal breathing. So, glossopharyngeal breathing, amot yan isda. Isda nga na breathe. Air gulping, okay? O gulping, air gulping. So, in here, can also be taught to assist coughing. Yun. So, na kita ito. Okay. Positions to relieve dyspnea. Kung may naman ito mga position that relieve dyspnea, the most common is forward leaning with arm support. If your patient may the SOP, bisan di mo nahiya sigmo, di mo na i-teach nga amo yung pag-relieve with dyspnea. Okay, sometimes na nakikunat nira na nare-realize na nira nga amo yung mas comfortable nga mas maupit akong pagginhawa o nare-relieve it ako ng SOB. Nakikita mo kasi this is one of the signs nga may daniya problem ha pulmonary. Okay, a pulmonary system. So kay forward leaning with arm support. So on forward leaning with arm support, animal upper extremity naka weight bear. Kay ko nito sugad? In the forward leaning, optimize the length tension relationship of your diaphragm and forward leaning. And the arm support or the weight bearing and imo upper extremity, it allows the pectoralis major muscle and minor and major muscles to assist in elevating the rib cage during inspiration. So we know this already. If it is a closed chain exercise, before open and closed chain exercise, open chain exercise is that the muscle contract or pulls the insertion of the muscle towards the origin. That is an open chain exercise. But if it is a closed chain exercise, naka-close ang imo distal or naka-weight bear nimo distal part, na reverse ang imo contraction in which an origin ng muscle ginpupul niya towards the insertion. Amit na hinabo pag naka-arm support niya. So an imo pectoralis major muscle, when it is a closed chain or it is a weight bearing position and upper extremity, diri na function as a internal rotators and flexors of the shoulder, but they act as the elevators of the rib cage. So balik na reverse ang iya movement. So na-elevate ang imo rib cage, which can assist her breathing ang imo patient. So this position may be combined with other breathing techniques. So ano ato ang best nato nga breathing technique for dyspnea? Ano to? Ang para SOB. Ada pa kamo or waray na kamulida?
Ade pa, ma'am.
Okay, ano man ang aton breathing technique nga para SOB or dyspnea? Okay, kamo nang matin and demonstration, it is the pursed lip breathing. Pursed lip, amitin gamiton. So in position nga forward leaning with arm support, i-combine mo yung pursed lip breathing, okay na ito. So i-advise mo ito may mga SOB. So kung naman hayat asthmatic, pwede niya ipatry niyo. Okay, so these are the positions to ease breathing. Sitting, leaning forward at the table, and sitting upright. But if you notice, duha nga kamot ada with iya lap. So it's still a close or a weight bearing position at iya upper extremity. So if you notice, naka weight bear tanan ng iya upper extremity, which the principle behind this is amo nang explain kanina. Okay? Another position to relieve dyspnea is the reverse Trendelenburg position. Okay, this is the opposite of Trendelenburg position in which ang reverse niya aniya ko ang tawag ito aniya head naka-elevate. Okay? Person supine with their head above their trunk and lower extremity. So this is kind of this is some advice para sa mga patient nga din nakakalingkod, sinang mga bedridden. Okay, kung may niya SOB, so pwede niya nga position. Kaya niya position because in a supine position, ang imong abdominal contents na move move upward. So, ang imo diaphragm dili nakaka-function well or dili nakaka-contractin maupay kung ang abdominal contents ulang haiya. So dapat ini-elevate mo ang iya head para ang abdominal contents bumalik ka ubos na magka-den space ang imo diaphragm to move downward during breathing. Ayun. And reduce because of the abdominal contents, it reduces the resistance of the movement during breathing. Okay. Another semi-Fowler's position. You may ask, anong pagkakaiba kakaiba din reverse Trendelenburg position and semi-Fowler's position. Okay. The semi-Fowler's position is 45 degrees, right? So inihiya, medyo less than 45 degrees. Okay. So pwede yan semi-Fowler's position. Okay, elevated 45 degrees. Ini nga pillows under the knees for support, that is proper positioning talaga. Or proper bed position, maano naman kita ito. No? Ang concept the knee is the same. Ang content and abdominal content na diri makaulanghan, excursion ng diaphragm. Okay, this position is used often for patients with congestive heart failure or other cardiac conditions. Okay, these are the positions to relieve dyspnea. Okay, so my question. My question, Waray.
May, ano na.
Sige, ang question.
An ha phase 2 mamhan kanan venous disorders, di ba? An self-management, an at night na lang nag-apply in compression bandage. Kaya
Okay. Okay, so Mary, that was not venous disorder but for lymphatic disorders or lymphedema.
Yes,
so anatong phase 1, phase 2 is lymphedema. Okay, at night na lang kasi nag-start ka naman mo phase 1. Diri ma-move diri ka ma-move sa phase 2 kung diri pa nag-subside imo edema phase 1. Okay? So at night na lahiya kasi nahimo naman nimo or continuous ka naman hanimo kumbaga himbuhat naman ni mga tanan didihan phase 1. So kumbaga at night especially may exercises ka na nga nahimuhan phase 1 in continuation ng phase 2 and imo muscle exercises or muscle contraction amo na help na imo tawag itang pumping imo lymphedema. And beside that, may compression garment ka lagi hapon. Pero ang bandaging is just for one night time lang with elevation niya at night time lang kasi that time na waray na nimo contraction na nimo muscle. Kasi nakaturog ka na.
Okay. No.
Oo.
Thank you.
So, kikitaon mo, before ka ma-move to phase 2, kikitaon anay nimo kung nag-subside na gulman niya edema. Tapos kung kailan lang mo na i-less mo na or kuhaan mo ng 24 hours nga bandaging. Okay? Pero continuation palagi pa nimo compression garment. Okay? Ano mo mga stocking, continuation lagi pitera. Especially when the patient is walking. O independent position. Okay, so any class activity next week, magpe-present ka mo, continuation ng iyo IE, ang iyo patient lagi hapon. So, namin nagpagkana kanina, provide pa kami anamon patient history and test and measure. Ayaw na kami na akong copy hadto. And then when you present it, pwede ka Word document na lang, tapos you can submit it through GC na lang later or after aton after naton discussion. Send that gabi nala. So pagpasad niyo, ito na ito, work pisan ng Word document, okay lang ito niya. And then, basta in continuation iyo ginhimo nga patient history dito, handatin niyo nga IE. Kumbaga, ikukumpleto na natin ang IE, idugang niyo problem list, ICF, diagnosis, prognosis, the plan of care, which include the goals, long and short-term goals, plus the patient education and family education and intervention. Dapat ang iyo patient and family education is separated hindi mo intervention. Kasi it na hinabo pag intervention nga part, magbutang kang family and patient education, halaba kasi hiya. Or, iduruting ka hubya, nabutang ka na lang patient and family education, pura ka nag-specify kung ano nga patient and family education. Dapat na-specify ka. Kung baga, naghihimo ka ang plan of care, ma-specify ka kung ano ang imo patient and family education. Like, for example, didihan aton akong student before, okay? Ang iya patient family education included niya ang nakabutang. Ano ito? Ay, lasing mo rin din. Very nice. Wala ko may kaupo din family, patient family education. Okay. Adi ngayon, mabaling kita ng sa. I-include ko lang niyan, mapinalakita ko liwat. Ano tabi. Ayun. Patient will be informed about his condition, his clinical presentation, and signs and symptoms, and different strategies to manage the symptoms. Okay? Patient will be informed of his medication, including its purpose, dosage, possible adverse effects, and signs of over-medication and under-medication. Okay. Baga ginduro ko din niya. Pero sakto okay ito. Okay, patient will be informed on the different preventive measures to minimize secondary complications and impairments. So patient or family will be informed of the different strategies for energy conservation and activity pacing techniques. So ano yung patient family education na depende ang imo condition. Na depende ang imo patient condition. And family will be informed about the importance of patient support groups for faster recovery. Pwede ka mo din i-include ang skin and foot care. So, pwede kapit nimo ha patient family education. So, kung imagine na laini ang patient family education, kakali mo permitted intervention, duro na itong kalabalabaan. Unless na kung matibubutang mula nila patient and family education, di ka na mag-specify. So, mas nag-specify ka. Okay? So, i-add ko na later, may kulang ang mga part and iyo part. Okay? So, may question pa? So, ang aton demonstration, ang posture drainage, ang MLD, and and lymphedema exercises, ayun, or exercise for lymphedema, bobobligan tayo ito, herangatanan. Tagusaw sa unta ito nga, para at least marang kamuan sequence, mapaktisan yung sequence and different locations sa nimo postural drainage. Meron naman kamang concept ang postural drainage, ano? So, nagamit lang kita in gravity para ma-dislodge lang ang imoplema. So, if you notice, ang position ng patient, nadependehan location. Di ba? Location. So, kung singon taadi ha apex, ang problem, so, dili mo yung tuwaron. Itimihimuon is para ma-drain. Basta imagine mo na lang ang gravity kung tikay. Dili man hiya. Mungkari naman na ibaw haray na matiya didi itiya trachea. So harani na didi iya trachea. Diri kay apex ay didi pero itiya main bronchi o aya bronchus adi pa ubos. So timbubuhaton is nakalin backward hiya kaya di anterior part. Example ha apex anterior part, idi o apex. Pwede ka pa likod. Likod nga ni makulubiya. Kasi, imagine mo lang kung tikain ng the gravity. Tapos tikain, imagine mo lang, picturehan mo lungs. Okay? Kasi picture mo lang mo mind kung hain mo lang. So, kung apex, papalim backward ko lang hiya. Tapos, itatry ko papercastida para ma-dislodge ang plema. Tapos, pamamove ang plema na di ubos. Kasi gravity ito assist ang gravity na assist ito. And then makadiya ubos na to ha main bronchi na niya. And then makatunay ibang. Okay? Dito kay adi na didi adi harani na didi na ba to kay in anatomy adi na didi adi pa didi mo main bronchi. Okay, so amo na ito, simple ang concept ng posture drainage. Bisan ka din mag-memorize. I-memorize mo la or i-mo la a picture and different location in mo lungs. Parang pamandi ka pamaram ko ng posterior, anterior, lateral, di ka maaram. Dapat maram ka na ito. Okay, so compare ito ka lobes na da. Okay, ang middle lobe, right light on may da. Okay, so dapat mabaro lang ang lingua, adilat di left side. So mabaro lang ka mo location. And then, kung tikain ang gravity, ang gravity tika di manubos, so kakainwan mo position para ma-assist ang gravity paggawa sa luka. Okay? I hope naintindihan ito yan. Kasi iba complicate pa, iba gid. May memorize pa. Gusto nila din memorize. Okay na ito yan. As long as maram ka lang locations, okay na ito. So may question? Okay na. Sige. Okay, thank you Han iyo pag-participate today. At least mo kita, nag-16, kanina 3 sila kami. Okay. Sige, thank you and see you next week.
Thank you, ma'am.
Bye, ma'am.
Okay.
Thank you, ma'am.
Bye-bye.
Thank you, ma'am. Okay.
May nabasa ko kadto, nunayakan. Uy, pay, madunod ako ng wati. Wala rin pa mag-aksita.
Di princess, nagpipinan mati.
Ha? Uy, nakaunyo.
Di princess, nagpipinan mati.
Hi, sis.
Oh, nawati.
Hello po. Hi,
Nag-chat,
AJ.
sis?
Hi, Phoebe. Goodbye.
Yay!
Hello po.
Yun nga nga turog na
Ilang
din.
shot?
Dalos.
Ada pa? Ay, mo.
Kasang sakitera.
Ano? Issue ka, Dave.
Hi, ko na siya.
Mukha mo lagi.
Hindi pagkamata na ka mo. Tapos
Guys,
na
wake up,
klase.
guys.
Picturean ko.
Wake up, guys.
AJ, wake up, AJ. Says, wake up.
Wake up,
Mga
everyone.
present and ano.